Welcome to week 2. This week we're diving into one of the most critical aspects of facility management, pre-participation health screening. Why health screening matters. Imagine you're opening your facility tomorrow morning. New member walks in, fills out paperwork, heads straight to the treadmill. 30 minutes later, they experience a cardiac event. What could have prevented this? Proper screening. ACSM provides us with evidence-based guidelines for risk stratifications or risk management, reducing the risk. We need to identify individuals who may have underlying health conditions that increase their risk during exercise. This isn't about excluding people, it's about ensuring that they exercise safely and comprehensively. So the ACSM in our textbook provides us with standards and guidelines. I'm not going to read all this stuff because it's in the book and you can read these on your own, just so you're aware of that there are standards and guidelines for the pre-participation screenings. So we have this page. So then we have these 5 exercise pre-participation health screening standards, and then we have these 2 guidelines for the screening. Here we have a chart about how we take the information from our pre-participation screening and break that down into what should actually happen. So again, this is in the textbook. I'm not going to go into too much detail on these because the book does a better job of describing these than I can. But effective screening includes medical history questionnaire, identification of cardiovascular disease risk factors, some current health status assessments, medication review, and previous exercise history. And so we have a couple different kinds of screening tools that we can use. One is called the Physical Activity Readiness Questionnaire, or PAR-Q Plus. This is a standard tool, but it's just the beginning. Your facility needs a comprehensive screening protocol that goes deeper for higher risk individuals. Another one is the pre-activity screening questionnaire, or PASQ. Again, the textbook has this, so you can take a look at this. And another one is the health history questionnaire developed by the ACSM. Again, the textbook goes into more detail about this. Not everyone needs a doctor's notes before exercising, but the ACSM guidelines help us to identify who does. We'll balance safety with accessibility. We don't want to create unnecessary barriers while protecting our members and our facilities. Documentation is protection. Every screening must be documented and stored securely. This documentation serves multiple purposes: safety planning, program design, and legal protection. We'll discuss confidentiality requirements and retention policies later. And the informed consent process. Screening goes hand in hand with informed consent. Members need to understand the risk of exercise, the nature of your services, and their responsibilities. This week's assignment will ask you to develop a comprehensive screening protocol. So speaking of week 2 assignments, You have an AI enhanced pre-participation screening protocol development. You're going to use AI to research best practices for health screening and to generate forms. You'll compare your AI generated forms to the ACSM standards and other criteria, and then you'll develop procedures for your screening. You'll take the first chapter 1 practice quiz. Again, these aren't worth any points. They're just designed to help you with the midterm and final exam. And then we'll have our first Courage and Calling reflection discussion. So you're going to read chapter 1 of Courage and Calling and provide a reflection on how the material in the chapter 1 impacts you both professionally. You may not be working yet, but what about when you do work and how it impacts you professionally? And then you'll ask 1 to 2 open-ended questions. And again, an open-ended question is a question that can't be answered with a yes or no response. You'll read and respond to 2 other students' questions. I expect that each response back to your fellow students is a minimum of 1 fully developed paragraph per question that you answer. If you got any questions about what we're doing this week, please let me know. I'll help you as much as I possibly can.